The next one is Kim Anderson, who'll be talking on hospitalization patterns among infants with HIV in the era of universal antiretroviral therapy in South Africa. You can stand on the side. It's only for the really short people.
Good afternoon, everyone. Yes, I'll be speaking on hospitalization patterns among infants from South Africa who started ART before the age of 3 months. So, as previously mentioned in earlier talks, despite the progress made with vertical transmission prevention, there were 160,000 new infections in children in 2020, and we also heard today in 2021. And 10% of new HIV infections globally are occurring in children. It's expected that the shift to earlier infant diagnosis and earlier ART initiation will reduce morbidity and mortality, but studies examining hospitalization in resource-limited settings in the context of early diagnosis and treatment are limited. In South Africa, HIV-exposed infants were initially tested for HIV at 6 weeks of age, but since 2016, HIV-exposed infants have been tested earlier at birth, which has facilitated earlier diagnosis and treatment. For this study, we used routinely collected data to identify infants with HIV who started ART before the age of 3 months in the Western Cape province of South Africa between 2013 and 2017. Throughout this time, the policy was universal ART for all infants, regardless of clinical or immunological status, with fast tracking of ART initiation. The standardized first-line regimen for children aged 4 weeks and older consisted of abacavir, lamivudine, and lopinavir-ritonavir, and a standardized first-line regimen for neonates was introduced in 2015, with ART initiation recommended on the same day as diagnosis. Infants below the age of 4 weeks were initiated on zidovudine, lamivudine, and nevirapine, and after 1 month of treatment, nevirapine was switched to lopinavir-ritonavir, and zidovudine was switched to abacavir. In this analysis, we described hospitalization and mortality from birth until 12 months after ART start. Record reviews were performed in a subset of infants who attended 3 tertiary level IDEA facilities to more closely examine the reasons for hospitalization. We examined factors associated with hospitalization using mixed effects Poisson regression and logistic regression. Different scenarios we anticipated for infants who might start ART very young were infants diagnosed with HIV from routine testing, previously performed at 6 weeks in our context, but since 2016 performed at birth and 10 weeks, as I mentioned before, or infants who were only diagnosed with HIV after getting sick and needing hospitalization, and then were likely started on ART in hospital. So hospitalization in these infants might occur at birth for reasons such as prematurity, low birth weight, or infections, or hospitalizations might occur in infants who are not yet on ART and get sick as a result, or infants who have already been started on ART may get sick and require admission. We identified 840 infants who started ART below the age of 3 months in the province. After birth PCR testing was introduced in 2016, the median age at ART start decreased from 57 days to 19 days. At ART start, 29% of infants had severe immune deficiency, and 36% had extremely high viral loads, over 1 million. And you can see that older age at ART start was associated with higher viral loads and lower CD4s at ART start. This graph shows the number of hospitalizations on the y-axis by time since ART start in weeks on the x-axis. So the negative numbers are weeks before ART start. And the blue bars show admissions that occurred after birth, whereas the peach and orange bars showed admissions after 1 week of age. Admissions peaked prior to ART start, showing how admissions often lead to infant HIV diagnosis and precipitate ART start. The pie chart shows that around a quarter of all admissions occurred in the early neonatal period, a quarter in infants after the early neonatal period who had not yet started ART, and around half of all admissions were in infants who had already started ART. The bar on the left shows that overall 69% of infants were hospitalized, with around half being admitted only once and the remainder more than once. The bar in the middle shows whether admissions were in the early neonatal period, which we defined as the first 7 days of life, or whether they were later. And we can see that 16% of infants only had an early neonatal hospitalization, a further 16% had an early and a later admission, and 37% had only later admissions. In the bar on the right, we focus just on the 53% of infants with an admission after 7 days of life, by which stage we could reasonably expect that HIV would have been diagnosed and treatment started. In total, 28% of infants experienced an admission before they started ART, with half of those experiencing a further admission after ART start, and 25% of admissions only had an admission after ART start. The pie chart at the top shows that just under half of all infants started ART during an admission, with just over half of these inpatient ART starts being after the age of 7 days. Infant mortality was 5% during the study period. This slide shows random effects Poisson regression results of associations with any hospitalization, irrespective of whether before or after ART start, but excluding birth-related admissions. In Model A, adjusted for potential confounders, including sex, previous birth admission, and exposure to PMTCT drugs, we see that in comparison with starting ART in the first week of life, older age at ART start was associated with admission rates around twice as high, which increased incrementally with older age at ART start. The association was attenuated but remained higher when viral load and CD4 were included, that's at ART start, were included in Model B to evaluate their effects as mediators. Both were significant mediators of hospitalization. Rates were 50% higher if infants were severely immune compromised at ART start, and twice as high if infants had very high viral loads at ART start. This slide shows associations with hospitalizations, but limited to admissions after ART start. And in Model A, adjusted for potential confounders, we again see that in comparison with starting ART in the first week of life, older age was associated with hospitalization rates around twice as high. And in Model B, the age association was reduced when viral load and CD4 at ART start were incorporated. So the effects of age at ART start on admissions that take place after ART start are largely mediated by the higher viral loads and lower CD4s that arise in older infants prior to ART start when HIV diagnosis and treatment are delayed. Among infants with available results, only 43% and 45% had viral loads below 100 at 6 and 12 months, respectively. We used logistic regression to examine factors associated with having unsuppressed viral loads at 6 and 12 months after ART start, and found that infants who started ART later had, 2 to 3 times more likely to be unsuppressed at both 6 and 12 months. And as with the hospitalization models, the effect of age at ART start was mitigated by the association with very high viral loads above 1 million at ART start. Among the subset of infants whose hospital records we reviewed, the reasons for early neonatal hospitalizations were mostly related to prematurity or low birth weight, and most admissions thereafter were due to infections, of which 81% were lower respiratory tract infections or gastroenteritis. Intensive care was required in 22% of admissions after the first week of life, including invasive ventilation in 14%. Excluding the early neonatal hospitalizations and focusing only on infection-related admissions, infants who started ART later had much higher, up to 18 times higher odds of infection-related admissions than those who started ART in the first week of life. This was partially mediated by high viral loads at ART start. In conclusion, high hospitalization incidence observed both prior to and after ART start, despite early ART start before the age of 3 months, is concerning. Later ART start is associated with higher rates of hospitalization, both before and after ART start, and is associated with higher viral loads and lower CD4s at ART start, which in turn are strongly associated with higher rates of hospitalization, particularly infectious cause admissions. Birth testing, early infant diagnosis, and early infant ART initiation are important to reduce this burden of hospitalization. And infants who acquire HIV in the era of universal ART are vulnerable and continue to have substantial morbidity risk despite earlier ART start. I'd like to thank my co-authors and acknowledge the infants, the mothers, clinicians, and service providers, as well as thank the Provincial Health Data Centre and our funders and the workshop organizers for the invitation to speak. Thanks.
Thank you.